Hello everyone, this is Sharada from Palamur University, Department of Pharmacology, Mahabubnagar. Today I am going to discuss regarding the pathophysiology of two main infectious diseases, namely tuberculosis and typhoid. Tuberculosis. Tuberculosis is a contagious infection which is caused by the bacteria called Mycobacterium tuberculosis. Basically, it is an airborne disease, so it spreads from one person to other person through the droplets of infected person's cough and sneeze, touch, and other activities. Tuberculosis is classified into two types, namely latent tuberculosis and active tuberculosis. Latent tuberculosis persons generally do not show any symptoms and they do not feel any illness because of their strong immune response, which is enough to fight against the Mycobacterium tuberculosis spread. And they are not contagious too. And tuberculosis disease is nothing but active tuberculosis condition, or we can also consider it as primary tuberculosis condition. These persons have generally symptoms and the person generally feels the illness. And the main, most and important symptom of the tuberculosis is cough, which lasts more than 3 weeks. And it is followed by chest pain, loss of appetite, chills, unintentional weight loss, fatigue, night sweats, fever, coughing up the blood rarely. So, whenever the person is exposed to the Mycobacterium tuberculosis bacilli droplets from the environment, around 25 to 5% of the people generally have the primary tuberculosis or active tuberculosis, and the remaining 75 to 95% of the people generally have latent tuberculosis because of their strong immune system. If the immune suppression or the weakens of immune system occurs in that person, this latent tuberculosis will get converted into active tuberculosis, and the bacilli reactivated and they can spread to the other parts of the body and causes the extra pulmonary tuberculosis also. So whenever the this Mycobacterium tuberculosis inhaled by the person, that generally reaches to the lungs and enter into the macrophages. Inside the macrophage, the bacteria will get multiply and it forms the granulomatous lesions in the lungs. And the 95% of the granulomatous lesions generally calcifies and inhibits the growth of bacteria if the person's immune system is strong enough to stop the spread of bacteria. And the 5% of the lesions generally liquefies and they coughed up in the sputum. Bacteria will generally coughed up in the sputum and spreads to the other humans. And also this liquefied lesions, they spread through the blood and to the other organs that causes the extrapulmonary tuberculosis, and it leads to the death also. Whenever the immune uh, response is weakens or immune suppression occurs in that person, that leads to the reactivation of the bacteria, and again the multiplication starts and the process will repeat. In this way, it generally spreads inside the body and spreads one person to other person. So here you can observe the primary lesion inside the lung. So how it will appear means, it is core form of the primary lesion is formed by the uh, caseous calcification, and it inhibits the growth of bacteria inside the lesion. And also it contains giant foamy cells and infected macrophages, and these infected macrophages are surrounded by the healthy T cells, which also inhibits the spreading and growth of the bacteria outside this granulomatous lesion. Coming to the treatment of tuberculosis, so this tuberculosis can be treated by giving antibacterial drugs, especially antitubercular drugs, and also it can be managed by the special dietary meals, and also it can be managed by the supplements of probiotics and vitamins. And sometimes the person also needs immunostimulants and immunomodulators to correct the immune system response. And the next infectious disease is typhoid. This typhoid is also called as typhoid fever and enteric fever. It is an infection, often fatal, and characterized by the intestinal inflammation and ulceration, which is caused by typhoid bacillus called as Salmonella typhi. So which is usually ingested or introduced with a contaminated food or drink or any other water. And the most common symptoms of the typhoid fever are high fever, headache, weakness, dry cough, stomach pain, constipation, and the rashes. So whenever it is ingested, Salmonella typhi, the bacteria, whenever it is ingested through the food or contaminated drink or water, it requires 5 to 14 days to reach the reticuloendothelial system and to produce the signs and symptoms of the disease. This period is considered as incubation period for the Salmonella typhi. So whenever it is ingested, the Salmonella typhi passes through and between the epithelial cells in the lining of ileocecal area and leads to the intraluminal multiplication. So this intraluminal multiplication of the Salmonella typhi activates the immune system, and it causes the mononuclear cells to reach that place. And these mononuclear cells, they are converted into macrophages and engulf the Salmonella typhi in that area. So this Salmonella typhi bacteria remains viable after the engulfment also and continues the intracellular multiplication. So this complete response, inflammatory response in that area, it causes the necrosis and hemorrhage or perforation or ulceration of the intestinal wall, and also leads to the hyperplastic changes in the mesenteric lymphoid tissue. So at this condition, the bacteria, it may re-enters into the bubble, or it may found in the stool specimens, and it's ready to spread to other human beings through the contamination. So in this way, the disease generally will gets progressed. And in the management of typhoid fever, we can have some supportive cares like maintenance of adequate hydration with fluids, and giving the antipyretics to reduce the fever, and appropriate nutrition to reduce the weakness and fatigueness. And also we need to give a specific therapy, that is antimicrobial therapy, to eradicate the fever. So here we can use the chloramphenicol and ampicillin, amoxicillin, trimethoprim and sulfamethoxazole and fluoroquinolones. And in case of quinolone resistance, we can also go for azithromycin and also third generation cephalosporins. Thank you.